Hello, everyone. My name is Elizabeth McElwain. I am a Master's of Public Health student here at Eastern Washington University. And during this presentation, I will present my applied practice portfolio that I completed during the summer and fall quarters of 2023 for Eastern Washington University's Master of Public Health program. Going on to the next page here, we're just going over a table of contents of everything contained in the report. As for our introduction, my APE was completed at my current employer, which is Adapt Health. This company is a durable medical equipment company that serves 47 states and employs over 10,000 people. So it's quite a big company. I work specifically in the Mid-Atlantic region in the Carlisle, Pennsylvania office. And everything that was designed for this APE was designed for the Mid-Atlantic region, specifically central Pennsylvania. My site supervisor for the APE was my direct boss. Her name is Chauncey Naylor. She is a respiratory therapist of over 20 years, and she is honestly just a wonderful boss and a great mentor. The APE took place between July 10th and recently concluded just on October 19th. So it was quite a long APE, and I did get a lot of things completed, which is very exciting. So moving on here to the next page, we'll go over roles and responsibilities. So I am an active respiratory therapist. I have been for the last 11 years. So normally at my job, day to day, I work as a respiratory therapist, going to patients' homes and educating them on high technology respiratory therapy equipment. For instance, these items can include ventilators, cough assist devices, high flow oxygen therapy, specifically through an airvo, or even tracheostomy setups and that kind of thing. We do even have ALS patients who are completely bedbound, invasive ventilation. So I take care of a wide variety of patients in my day-to-day. Anywhere from a 2-week-old to a 100-plus-year-old. So it's quite an interesting job. So I was very excited to get to do my APE at this place because it is such a broad, has such a broad range of patients that we can really help in different ways. So my goal for the APE, though, was to do something that wasn't necessarily in my day-to-day job as a respiratory therapist now. So I wanted to step more into the public health field in this assignment because that's what I hope to do going forward. So my site mentor could not meet for the first 3 to 4 days of the APE. So I decided individually that I would go ahead and complete a community or company needs assessment. So that's my first work project. And then my second work project was decided based off of the company needs data. And it is a document that educates the medical equipment technicians or drivers at Adapt Health. So that is basically my roles and responsibilities within the APE. My site supervisor oversaw everything, and she approved everything prior to it being submitted to corporate and everything like that, which we'll get into later in this presentation. So moving forward past roles and responsibilities, we'll go into my implementation plan. So my plan for my APE was to determine what the company's needs were. So I went ahead and created a survey on Canva, and I gave it out to willing participants. So there were 25 people in the warehouse, drivers, office staff, and respiratory therapists who were willing to participate in the survey process. So I went ahead, created the survey in Canva, and then distributed it through company text and email. And then everything was returned to me in the same way by text or email from the 25 participants. And then once I got the data back, I went ahead and analyzed the results of that data. So I inputted everything into Excel, and then I visualized everything with graphs on Canva. And that is how I presented it to my site supervisor at our first meeting on July 12th. Um, all of this information is also included in my written APE report in this document, all in the appendices, which we will go over later as well. My third step in my implementation plan was to meet with my mentor to finalize our project. So like I said before, I presented my company needs assessment data to her, and we ended up picking, mutually agreeing on a topic of education for the medical equipment technicians. And this was created here in step 4 on our implementation process. My mentor believed that this would be a a very helpful resource, first off, that will serve many for years to come. But also, she felt that it would be easier to get approved because it's not something that is being distributed to patients. So she thought that we would have a smoother transition into getting this approved and everything working out if we created something used by the staff and not distributed directly to our patients. So once we determined we were going to do that, my mentor went to the regional vice president of Adapt Health, who is Dean Gavotas. He approved the project. She submitted everything to him, and he said everything would be fine and dandy, and we'd be good to go in using the project. So I did, on step 6 here in my implementation plan, I did go ahead and create the education. I started using Canva to create everything. And then I used my company iPhone to take photographs of all of the equipment at the Carlisle warehouse to include within the APE document, within the driver education. I shouldn't say APE document, to include within the driver education. So all of the photographs, almost all of the photographs were taken by me. And all were uploaded into Canva to create the final document, which is included in Appendix C in this APE report. So moving on to step 7, once that entire document was created, I submitted it to my site supervisor on August 11th. The two of us had agreed it would be completed by Monday, August 14th. So I did submit it on Friday morning, August 11th. And I didn't hear much from my site supervisor then. Several days later, she did reach out and said that the project was wonderful and she was very, very happy with it. So then at the end of September, she did go ahead and submit the document and the presentation to corporate compliance and marketing. So corporate compliance took a look at the document and recommended that we change one piece of verbiage within the document, which I did immediately and sent it back. They said they approved the document within corporate compliance, and then everything was submitted to marketing. Marketing got back to us several days later and decided that they would like to make this, instead of a regional education, they would like to make it a nationwide education. So this actually is going to be a lot bigger than the original intended goal, which is good, but not necessarily great for seeing the data and seeing the results in action now. So while I'm glad that this is the project's course that it's taking, it is a little defeating not to be able to see everything come together firsthand. So again, my major work products. First one was to complete our company needs assessment, which I did by surveying employees, interpreting the results in Excel, and then graphing everything into Canva, which I will go over here in the next slide. And then my work product 2 is that high-tech respiratory therapy education for the medical equipment technicians, which is also within this document, and I will go over. So this document also, I just want to go over a little bit of what it will include. There were several meetings held with various people, which I'll go over as well. to decide exactly what would be included in this education. So what we ended up deciding on was oxygen, pediatric flow reduction meters, trach supplies, trach setups, ventilator downloads, adding oxygen to ventilators, and then also having a page of helpful tips, resources, and contacts. So we'll go over the specifics of our company needs assessment here. So this was the first thing I completed. So this bar graph, the first bar graph here, shows the results of question 1, which asked, of the options listed below, which do you feel would be the most beneficial for our patients? And the 3 options were improved employee education, improved patient education, or improved physician or referral education. So various occupations were surveyed. So I did separate some of the results by occupation as well, just to see if there were any like clues as to what specific occupations were requesting. So for employee education, there was an obvious quite a large amount of people who selected employee education, so an overwhelming majority. And then it looks like patient and physician education came in a very close second, but they were both very equal. So employee education is something that I knew I wanted to focus on from this question. So then question 2 said, please list any challenges you faced in your daily work at Adopt Health. So the most common things that were written down were, I did categorize these a little bit better, but I did break them down here. So lack of knowledge was actually the top issue that people felt they faced in their daily work. And from our results on question 1, it shows that drivers actually were the ones who felt this more frequently than any other occupation. So I felt this was important to bring up to my site mentor as well. So the second one, lack of knowledge, patient education, liaison education, and interpretation. So I did bring up all 4 of those subjects to my site mentor as well, just to see, because interpretation is something that I personally have had a lot of issues with, and it was something that was important to me. So I did want to bring that up, but we ended up going in a different direction. It's totally fine. So question 3, which was the final question on the survey, said, please list anything you believe could be improved upon at Adopt Health. So again, I went ahead and categorized everything to make it a little more simple for demonstration purposes. And the top results actually showed that 60% of the people interviewed or surveyed wanted driver education to be improved, which I was like, oh my gosh, it's a targeted, this survey really targeted direct specific company needs, which I felt was, just amazing, something really great that we can build off of. So again, the pie graph, the open pie graph there shows the various items that the people listed in the survey. And then the pictogram below depicts that out of the 25 employees surveyed, 15 actually suggested enhancing education for medical equipment technicians, which correlates to the 60% above. I just wanted to demonstrate it in a different way. So moving on to my activities that I completed. So I did go ahead and do my inputs, my activities, my outputs, and my anticipated outcomes here on this page. So first off, it did take a total of 108 hours to create all of my final work products. Now that is obviously not including the academic work that I put in specifically for school. This is just for the actual job that I did. So some of my inputs were medical equipment. So I needed to have medical equipment so I could show people how to properly use it. So I did have all of that available to me at various warehouses. I had my site supervisor, who was Chauncey, and then I had computer, internet, Canva, Excel, all these various items for document creation and ease of communication as well. So computer, internet, email, text message, phone, all of those items. I had my fellow employees. So I had operations managers, I had warehouse managers, I had drivers, I had respiratory therapists. I had various people who influenced this project for the better. And then I also had regional vice president, Dean Gavotas, who ended up approving the entire project. And then we also used Microsoft Teams a good bit, well, several times to complete meetings, which was very helpful. So that was a company resource that I utilized as well. Some of the activities we completed were the pictures of medical equipment that I used in the document, and I took those pictures with my company iPhone. um, I did do independent creation of the education in Canva, and that was something that I purchased on my own, and I already had a subscription to, so that I already had. I did the company needs assessment. And then I had meetings with operations managers, warehouse managers, my site mentor, and then I ended up having, to create and edit all of this education, format all of the photos. So all of that was put into my activities section as well. For my outputs, I had my company needs assessment using Excel and Canva, my data analysis and interpretation, which I did through Excel and Canva, and then my high tech respiratory education, which I created through Canva. And I also did my oral recorded presentation through Canva as well. Um, my anticipated outcomes for this. Now, I won't get to see these necessarily because of the trajectory of my project now, but ideally, what I'm hoping for is improved patient safety, improved employee safety, a reduced need for reteaching, which will end up saving the company money in the long run because we're not having to send more employees out to do repeat teaching when one won't be enough. Ideally, we're going to improve patient satisfaction because our employees will have more knowledge to provide to them. And then we're going to have improved patient safety, which I went over, and improved driver competence and confidence. I think this is a huge, huge one. So, improved driver confidence is going to go a long way. Obviously, driver competence too. That's the main goal here. But adding that extra level of confidence is something that's going to benefit the company, and it's going to give the drivers a sense um, of realization, self-realization that they are helping someone. So that's important. Going over our connection to my CEPH competencies, my CEPH competencies, I did use competency number 3, analyzing qualitative and quantitative data. So this I did through my company needs assessment, and I used Excel and Canva to analyze and interpret all of my results. So there is my CEPH competency number 3. My CEPH competency number 4 was also my community needs assessment. I took the qualitative data from the surveys that I created, and I entered all of that information into Excel to interpret and analyze all of the results, to present to my site supervisor to pick the topic for the project. So, CEPH competency number 9 was to design a population based program, policy, or intervention, which I did through creating the education for the drivers. So, driver tech education, which is written and oral presentation, which is included within this document. And it created accessible, uniform education on high tech respiratory therapy needs for our medical equipment technicians. Our CEPH competency number 19, this is communicate audience appropriate public health content in writing and through oral presentation. So again, the driver education that I created along with the oral presentation, both located in Appendix C and then Appendix D respectively, they are my work products that satisfy this competency. And then my CEPH competency number 21, which integrates perspectives from other sectors. This was done through my company needs assessment. I have my meeting minutes in I believe it's Appendix B, that goes over my meetings that I had, to include others' points of view into my end goal project. So I met with warehouse staff, drivers, respiratory therapists, my site supervisor, clinical specialists, liaisons, and all of that information that I got from them was incorporated into the community needs assessment or company needs assessment, which is located in Appendix A, and the meeting agendas located in Appendix B. So then we'll go over my conclusion here. So overall, like I said, my document that I created is going to be used on a nationwide level now. So ideally, we created it at a regional level, and I really just wanted to measure patient satisfaction before and after implementation was my ideal project that I started with. However, we ran into some issues getting the patient satisfaction survey results from corporate compliance. So at the last minute, I did have to change parts of my project, and create something brand new almost. So while all of those things were a lot of work to complete, I am extremely happy with the final product, and I'm so excited to see it used on a nationwide level. So this sort of goes back to the reflection here. Like I said, while a nationwide educational initiative was not my intended goal, it is nice to see it be used in such a large scale educational initiative. So I know it's going to be used. I know my hard work is going to benefit people, and that's all I ever wanted for this project. So I am very happy with the results. Here are some references I used to gain some background information on the company. And then here are my appendices. So you can review these, my survey form, my Excel spreadsheets. Here are the meeting agendas I discussed. And then here is the actual education that I produced. So go through that. There's a lot of good information on here. And then at the end, we have our resources. I also included interpretation services in here because it was so close to me. It has been a huge resource just to me to even have this written down, and for the other RTs, because the location IDs vary by area. So this has been a very helpful resource to not only the drivers, but to everyone within Adapt Health as well. So and then this is...
Hello, everyone. My name is Liz McElwain. I am a respiratory therapist.
That is the recorded education that I created for the drivers as well. So all in all, that concludes my applied practice experience portfolio presentation. I welcome you to reach out to me with any questions, concerns. I have enjoyed this program thoroughly, and I am so glad to have gotten to learn everything from such wonderful staff, such wonderful educators, honestly. So again, I thank you. Have a wonderful day. Take care.